Hello, Johnny's ambassadors. Welcome to yet another expert webinar series for parents. I am your host, Laura Stack. I am blessed to be the founder and the CEO of Johnny's Ambassadors, where we educate parents and teens about the dangers of today's potent marijuana on adolescent brain development, psychosis, and suicide. We have a very special guest with us today, Caroline DuPont, whom I will introduce in just a moment. After we cover a couple quick logistics, this session is being recorded. Please share it with your friends and family. There is a handout available, which Caroline has kindly provided, a copy of her slides. You can find that either on this page if you're watching a recording or in the control panel of the GoToWebinar app. Caroline will be conducting a couple polls just to keep you on your feet, so be ready to click on the polls when those are run. And at the end of her presentation, she will be taking questions. So we'll leave about 15 minutes or so at the end. So as you think of questions, please type them in so that you don't forget them, and we'll take the last few minutes to cover those in the order they came in. So now I am pleased to introduce Caroline, Dr. DuPont, who is the Vice President of the Institute for Behavior and Health, a 501c3 nonprofit organization that identifies new ideas to reduce illegal drug use. In her role, she focuses on the areas of substance use disorder treatment and youth prevention. She maintains a private practice specializing in anxiety and addiction. Formerly, she was the founding president and principal investigator of DuPont Clinical Research, Inc., where she directed a team that conducted studies of investigational medication for the anxiety and affective disorders. Dr. DuPont received her MD from the University of Texas Health Sciences Center, Houston, and completed her training at the Johns Hopkins Hospital of Psychiatry. Johns Hopkins Hospital, Baltimore, where for years she held an appointment on the clinical faculty of psychiatry. She is board certified by the American Board of Psychiatry and Neurology and by the American Board of Addiction Medicine. She is the co-author of numerous publications and several book chapters on anxiety and addiction. Caroline, welcome, and thank you for being one of Johnny's ambassadors.
Thank you so much for that wonderful introduction. And thank you for inviting me to join you today. I feel very fortunate because I just had the opportunity to meet Laura at a different meeting a couple weeks ago online. And here I am getting to speak to
all.
Here
you are. Our pleasure. Our pleasure. Thank you so much.
So again, thank you so much for inviting me to come and speak to Johnny's Ambassadors. It's such a pleasure to be here. I'm talking today about substance use prevention. We're talking about primary prevention predominantly, but we're going to touch on some other types of prevention as well. So without further ado, we'll go on. So here's our basic takeaways. We're going to go over each of these things several times. So I'm not going to spend much time on that. This is what you're going to learn while you're here with me. So when I'm talking about prevention, what we find is a lot of people are interested in prevention. It's a pretty, it's an area where you can get a lot of consensus on certain topics, but often people's prevention programs are pretty substance specific. And that's great. People have a lot of different reasons to do that, but I'm going to talk about why we need to think bigger and why we need to be really clear that there's no good or safe drug for adolescents. And it all boils down to this, the brain. So I think probably all of you know this, but I still love this slide. So I always want to show it. You see it in a lot of different formats. This is really showing the adolescent brain development continues up to the mid-20s. And on this slide, only the deep purple is fully developed. And that means there's a lot of growth that continues through those high school years and even into those college years. And anything that you do to the brain during that growth period can have permanent and lifelong implications for that person's brain health. And that is really important. And when I talk to kids about this, they are very excited by this. they are very excited to know that their brain has a lot more to grow, and they're going to be even smarter than they are now. And so brain protection is something that, again, we can get a lot of agreement on. Yeah, that's really important to protect that brain during all those growing years. So what happens to the brain? How does addiction happen? So you have to think about that drugs are chemicals that have been manipulated by humans to superstimulate the brain's complex reward system. So the brain has hardwired into it systems that are there to promote normal survival things like food and sex. And the drugs you take can go in there and hijack that whole system. And when you have an animal model of this, you can see that animals will prioritize drug use over even things that they really need, like food. So that is, again, fundamental. We're talking about the brain science of addiction. And it's very important for people to realize that these chemicals are working on an extremely primitive central part of the brain that is being co-opted or hijacked for a completely false purpose. A lot of people don't think about this, but substance use disorders are pediatric onset illnesses. We don't really think about that. We think about them as being adults with substance use disorders a lot of the time. And it's really amazing to hear that 9 out of 10 adults, so 90%, began using before the age of 18. And many people well before the age of 18. And I'm going to show you that that earlier and heavier use has a direct correlation to the risk that person has for developing a substance use disorder. So this slide, I'm going to have a lot of graphs and things like that, and so some people love that and are really comfortable, and some people are like, yikes, numbers, graphs. So I'm going to, don't worry, we're going to talk about them, and they're going to be okay. So this graph is showing the correlation between how the age that the first person had in either alcohol or marijuana and their risk for developing a substance use disorder. So if you look at the red bars, you can see that we start with that less than 13 years old. And if someone who is less than 13, when they have their first drink of alcohol, they have a 47% chance of developing alcohol use disorder, basically half. So those young kids with that early alcohol exposure have sensitized their brain in a fundamental way and put it at extreme risk for a substance use disorder. But if you look all the way at the other side, greater than 21, 21 being our, of course, legal drinking age, if you don't have your first drink until you're 21, only 9% of people develop a substance use disorder, an alcohol use disorder. Again, that's almost 10%. That's not a sure thing. It's not a safe drug, but it's a huge difference in terms of risk based on the age at first use. And you can see this same correlation is true with marijuana. So it's pretty simple. You can see age of first use around 13, you have a 17% chance of developing a marijuana use disorder versus only a 4% chance if you don't have your first marijuana exposure until the age of 21. So this is the kind of slide that sometimes I think people who are really interested in marijuana are like, well, marijuana is really bad. Why is it these numbers so much lower? And I'm going to show you why I think that is. But for right now, I just want you to see that age at first use has a huge impact. And so it's really important to try to help people make the choices not to use until they're older, or of course not to use at all. So again, circling back to this question of alcohol versus other drugs, particularly in this case, marijuana. This slide is just showing us that we need to remember that alcohol is still the predominant drug that people take in this country. And by far, it's the heaviest one. So often I speak to groups that are really focused on reducing opioid related deaths and bad outcomes, and that's really their focus. And they look at this and they're like, 1.1% compared to 50%. I'm like, yeah, that's the reality. The opioid deaths are horrendous and have actually changed our national life expectancy. But alcohol is doing a tremendous amount of damage. So don't forget that one as we're talking about substances. So all substances put adolescents at use. All substance use puts adolescents at risk. And I think this is really important. And again, something I think you guys are really familiar with, that it can put you at risk for a lot of different things. So you can be at risk for physical health problems, mental health problems, serious injury and death due to accidents, becoming a victim of violence or of sexual assault, lower academic achievement, and of course, school, both high school and college dropout and poor performance. And these things are really often overlooked in terms of being just very significant risk for any adolescent substance use. So we can all agree that youth drug prevention is important. But is there a really clear goal? Many efforts are again focused on individual drugs or specific settings, or even specific amounts. So some people are really concerned about binge drinking, and other people are concerned about drinking and driving or drugs driving. And so we really need to think, when we're talking about prevention, can we get on the same page? So some of the questions are, what is a drug? So is alcohol a drug? Is nicotine a drug? What does it mean to be drug-free? Is that our goal? Is that our language? And what are we preventing? Are we preventing all use or misuse or overdose? And also, who are we speaking to? And what age are we considering youth? And I think that's a really interesting one, and also really important, because different young people like to be referred to as different categories. Are they youth, teenagers, students, young people? And when you're speaking to a young audience, I always think it's a good idea to ask them how they like to be referred to. So we've come up with the realization that we need to have a very clear prevention message that is a clear health standard. And that is no use of alcohol, nicotine, marijuana, or other drugs for reasons of health under the age of 21. And so we really want to make sure that we're spelling out exactly how we're answering those previous questions. We have a lot of universal health messages that we give to people all the time, of all ages, but particularly to youth or kids. How about always wear a seatbelt? Always wear a bicycle helmet. Avoid sugary drinks and eat a healthy diet. And exercise regularly. So I don't think anybody's going to argue with this. They're not going to fight us on these health standards. But I tell you what, not everybody does them. So if you take bicycle helmets, for example, from the time our kids are really young, we're popping helmets on them anytime they're on their scooters or on their bikes or on their rollerblades. But as they get older and they can be more independent, you see some people who are choosing not to use their bike helmets. But the health standard doesn't change. And nobody's arguing that the health standard has changed. And it's still something that, for example, doctors, pediatricians are comfortable asking their patients, do you regularly wear a bike helmet? And they're happy to give statistics on why it's important to wear that helmet really every time you get on a bike. But for some reason, we're really different in the way we talk about substances. And we have a harder time having that clear message. So sometimes it's because of societal expectation, this word experimentation. People like to think that drug use, or at least alcohol, is a normal part of adolescent development. It's just a normal experimentation process. And I really think we need to challenge that right from the beginning. All teen drug use is illegal for good reasons of health. And there are a lot of pressures that are trying to normalize drug use. So here we've got talking about it, commercial industries. So making things legal have a huge impact on the use. And again, this is something I think a lot of communities have seen up close and personal. And we're going to get some more to that. But I really want to, again, be very clear on the importance of a straightforward health standard. So I'm going to circle back to this question. Why not be substance specific? So what's wrong with saying, you know, my real big concern is alcohol or marijuana or drinking and driving, because, you know, that's my topic and it's really important. It's something I'm very passionate about, and I'm going to be right behind you and say, I think that's fantastic. I'm so glad you're doing that and you're fighting the fight, and please continue. But here's some important information we're going to share with you. For teens, all substance use is related. So this is some more data I'm going to show you, but I need to explain to you that this data, while we put this information together, which we at the Institute for Behavior and Health are very proud of, the data actually comes from the National Survey on Drug Use and Health. And so this is a nationally representative sample of 17,000 youth ages 12 to 17. And what I'm going to show you here is that use of any substance is associated with increased use of other substance, regardless of sequence. So sometimes we get into that gateway drug conversation, and we're going to talk more about that. But here, I'm going to show you this. So actually, is this where I'm supposed to? Yes, this is where I'm going to have a poll. Let's do our first poll about that very question.
Okay, everybody, I'm going to launch a poll here. And the question is, which substance is a gateway drug? So if you will please click on your screen, which ones you think, which one is correct? Alcohol, marijuana, nicotine, another substance, or all of the above? Which substance is a gateway drug? All right, we have 86% who have voted. We'll give everybody just another couple of seconds here to vote. All right, let's close the poll and see what the results are. Aha, can you see the results here, Caroline?
I cannot.
Okay, so marijuana 5%, nicotine 5%, alcohol 0, other 0, and all of the above 89%.
Excellent. Excellent. Okay, I'm so glad to say that. I did get a little ahead of myself, so I might have given away the punchline, but that's okay. This is really important. Okay, so I appreciate you guys voting on this. It's really important because, as we said, regardless of sequence, all drug use is related. And here I'm going to show this to you. So this graph, again, I'm going to spend a moment on it, so don't worry if it looks a little much right now. So this is, again, using that national data of students aged 12 to 17. And on one side, we have no past month marijuana use. So they haven't used any marijuana in the past month. And on the other side, we have, yes, they did use marijuana in the past month. Those are the two sides. So again, going back to that, no past month marijuana use. So these are people who said, nope, I didn't use any. And what you can see is looking at these other things. So this first red line is alcohol use. So if they said they did not use any marijuana, only 8% of those used alcohol in the past month. But if they said, yep, I did use marijuana in the past month, there's a 44.6% who used alcohol in the past month, which is a jump of 5.6 times more likely to use alcohol if they used marijuana. And the next line has to do with binge drinking. So binge drinking is 5 or more alcoholic drinks in one day. And unfortunately, I think you guys know that binge drinking is very common in this age group. And you can see that if they did not use alcohol, they also were unlikely to binge drink. But if they did use, if they did use marijuana, they were unlikely to binge drink. If they did use marijuana, they were much more likely, almost 8 times more likely to binge drink. That's a really big jump. And here's heavy alcohol use, which is repeated binge drinking. And here we have cigarette use. And again, you see a very strong jump. If they did not use marijuana in the past month, they were quite unlikely to have used any cigarettes. But if they did use marijuana, they were 9 times more likely to use cigarettes. And here we have other illicit drugs, and this could be anything else. And again, you see this huge jump. So if they've used any marijuana, their risk of using other drugs is almost 10 times more likely. These are huge changes just based on that question. Did you use any marijuana in the past month? Not like frequently or daily use or anything like that, just did you use any? And you see these really big differences. So then we're going to ask the same question, starting with alcohol as our question. So again, this is pretty similar. It looks a little different, but it's pretty much the same thing. On the one side, no past month alcohol use. And on the other side, yes, past month alcohol use. What we've divided that section up into some alcohol use, binge drinking, and heavy alcohol use. So that's why it looks a little bit different. But the main thing I want you to do, if you just eyeball this, if you can see that the little bars on the no past month alcohol use are very small, and the bars on the yes past month alcohol use are much bigger. And of course, they get bigger the more alcohol use that we're talking about. So walking through this again, this is how likely were they to also be using marijuana if they did say they had used alcohol in the past month. And you can see these are really big jumps to their likelihood of using marijuana, particularly in the binge drinking and heavy alcohol use groups. Those are just enormous jumps on the basis of whether they had used any alcohol, binge drinking, or heavy alcohol use. And so here we're going to do, this is that blue line, that other illicit drugs. So this could be opioids, it could be stimulants. This again, you see very little tiny line on the no past month alcohol use and much bigger lines on the yes past month alcohol use. Going up again, the more alcohol you use, the greater that risk is of using other illicit drugs. And here we have cigarette use. And again, we see little tiny line. If they're not drinking, they're probably not smoking. But if they are drinking, their risk of smoking goes way up. And these numbers are really representative of the whole nation. So I want to again remember, this isn't a small study. This is national data of lots of people. And we're going to do it one more time with the association true for cigarettes. Now I do want to point out, I wish it said nicotine, not cigarettes, because as you know, we've had a major change in how nicotine is delivered with vaping, for example. But the study is an old study and it has the word cigarette, so that's what it is. So that's what the data shows. But again, no past month cigarette use, little bars, and yes, past month cigarette use, big bars. So I can go through it pretty quickly, but you can see 4.2 times more likely to use alcohol if they smoke, 6.1 times more likely to binge drink. Again, huge differences, 10.4 times more likely to report heavy alcohol use, 7 times more likely to use marijuana, and 7.7 times more likely to use other illicit drugs. So again, regardless of order, you're seeing a huge jump. And that's why we're talking about there not being a single gateway drug, but that drug use is related. Now, this data looks similar, but it's a different data set. So I want to point out that this is data that's Colorado high school students, and it's was from the 2017 Healthy Kids Colorado survey. So it is a different data set, but it's showing the same thing with vaping and nicotine vaping. And I think this is really important because it just supports that what we just said is it doesn't matter what you start with. If you've started with something, your likelihood of going into those other substances goes way up. So here you're just seeing it way increases in binge drinking in the light blue and non-medical prescription pain medications, methamphetamine, marijuana the past month, and heroin lifetime. I mean, these are huge, huge correlations that just go with the question of, did you vape in the past month? And so this really supports the same message, but with, again, a different data set. So it all boils down to a crucial decision, and that is whether to use drugs or not use drugs. It really becomes a single question, and it really underscores the need for a clear, straightforward youth prevention message. So that everybody's going to be like, yeah, but realistically, that's not realistic, right? So that's my question. Is my one choice goal to say, yeah, you have this choice as anybody at any age, but if we're talking about youth, to use or not to use anything, is that realistic? So I want you to do another poll now, and you're going to tell me what you think.
All right, so let's launch this poll, which is, what percentage of high school seniors have not used any substance in their lifetime? Ooh, good question. 3%, 8%, 19%, or 31%? What do you think the percentage is of high school seniors who have not used any substance in their lifetime? All right, we have 73% who have voted. Let's take a look and give everybody just another few seconds, up to 86%. All right, okay, good. Let's close that. And Caroline, I will share with you that 5% of our audience selected 3%, very low. 16 said 8%. 26% said 19%, and over half of our attendees, 53%, said 31%. So we will hide this poll and let you tell us the answer.
Here we go. Here is the answer. All righty. Yay. You guys did a great job. And I'm going to explain why your other answers were good too. So everybody did a great job on that one. So this is really fabulous data from Monitoring the Future, and it shows, we took this data, again, this was something that we worked on, and we took the data from Monitoring the Future, again, huge national data, and we looked at it in a different way. Everybody wants to look, again, substance specific, and they want to look at how many kids are using. And we said, wait, let's look at that same data and ask a different question. How many kids are not using? And what we found is there has been a huge change over time. And so if you look at the blue line, the bottom line, this is lifetime non-use. So these are high school seniors in high school. And the question is, have you ever used any substance in your lifetime? And so these are the people who said no, they didn't use any substances in their lifetime. If you look back in the 80s, those numbers were really low. They were about 3% of high school seniors said they'd never used any substances, no alcohol, no nicotine, no marijuana, no other drugs, about 3%. But over the past decades, there's been a very dramatic, steady increase in the number of high school seniors who are making that choice, that one choice, not to use anything. And so now it is, in fact, 31.4% of high school seniors don't use anything. They've never used anything in their lifetime. This is so exciting. When I started working with this data, the data we had at that time was showed it was 26% of high school seniors had not used any, and that was only a couple years ago. And now it's even better. It's 31%, and that, just to see that happening is so exciting, and to see that how things have really changed. But this can be very important when you're talking to adults, because a lot of times adults, when we went to school, it was a very different landscape. And so a lot of times adults don't really understand that there are so many, I mean, more than a quarter of high school seniors have clearly made this personal choice not to use any substances at all. And the brown line is also really important. This is past month non-use. And this, again, you see this dramatic change over time. And it's now up to 59%, almost 60% of high school students say they didn't use anything in the past month. This is really important because, first of all, again, we adults might have a skewed view of that, because if you look at that back in the 80s, for example, even excluding that bizarre dip that's right there, it was still only about 20% of high school students had not used anything in the past month. And now it's almost 60% of high school seniors have not used anything in the past month. And this is really important because you need to recognize that people can make the choice not to use at any time. And we're gonna circle back to that. But if you think about it again as a health prevention message, you wouldn't say to someone, you didn't wear your seatbelt yesterday, so you're excluded. So you might as well never wear your seatbelt because you didn't wear it, you already blew it. What? Please start wearing your seatbelt today. So, so you have to recognize that there's a lot of people who may have used sometime in their lifetime, but they are not using regularly, and they may have used and then realized that that's not what they wanted for their own life. So this slide really shows the same data. So that bottom line is the same one, the lifetime no use on one side and past month no use in high school seniors. But those other lines are showing 10th graders and 8th graders. And I just wanted to use this to show that this trend has been going on, as we saw for the high school seniors, but it's reflected even more so in the younger grades. And so you can have a lot of hope that in fact that line is going to continue to go in the right direction, with more and more kids making the choice not to use any substances at all. So that's really exciting. So now I'm going to talk about some more history lessons here with some more graphs. Again, this is pretty fun to look at, and is kind of showing some similar type of information, but in a different way. So this is again monitoring the future data, but it's showing past month, again thinking about that past month use of different substances, all the way from the mid-70s to the modern time, and showing how that's changed for each of these different substances. And what you will see is, for example, alcohol is gone way down for seniors in high school. And one of the things that happened in here, of course, was the change in the drinking age. And you can see how important that was in terms of decreasing. That happened around 1990, and you can see that made a big difference, that inflection point. But if you look at the other lines, let's look at cigarettes. Now, cigarettes have a little bit of a different line. They are pretty stable all the way up to the mid-90s. There's some fluctuation, but it's pretty stable. And then it just steadily goes down. And that is very interesting. That is when that big tobacco settlement happened and the Truth Campaign started. And we started a really big prevention push for smoking in kids, and it's had a tremendously positive impact. And so I always think it's so great to see how prevention really does work. And so the hard work that all of you are doing really does pay off over decades and generations, and that's really exciting. You also really see this in marijuana, but marijuana has got a different silhouette altogether. So marijuana was super high back in the 70s and early 80s. It really was. I mean, it is amazing because we think about what an issue it is for us now, but look what a problem it was back then. And so that's when the parents movement started, the original parents movement, because people were just overwhelmed. Parents were overwhelmed. And frankly, the establishment, the government, the doctors, they were sleeping on the job. They were not paying attention to what a horrendous cost this was to the youth. But the parents identified it and really pushed for change and for education. And it worked. It worked so well. So you see that goes way down. It just is very amazing how effective that was. But what happens in that inflection point where all of a sudden in the mid-90s you start seeing it going up again? That's the beginning of the legalization, and that tricky thing they did switching to medical marijuana is they're in for conversation, and they really worked on normalizing marijuana, and you've seen that it came up and it's pretty much just been stable ever since, and probably trickling up a bit as well, but that's very obviously discouraging for those of us in the field to see what that impact of that has been. And then that blue line is other illicit drugs, which again, fairly stable over time. So I touched a little bit on this idea of commercialization. And so we have a phrase that we like to use, which is commercialized recreational pharmacology. And the impact of commercialized recreational pharmacology is really quite devastating. So this has to do with people who are, and companies who are making money, profit on the exploitation of people, both legal and illegal drugs, where they're selling products that super stimulate that brain reward system. And vaping epidemic is a huge example of this. So, you know, I showed you that wonderful graph of the cigarettes and how much it's come down. It was down to 5% of high school seniors had ever smoked in their lifetime. And changing the delivery device had just really dramatic effect on that. New delivery systems, new potencies, new drugs that are coming out. There's always going to be something new on the horizon. So we can't be asleep at the switch and say, oh, our topic is smoked tobacco, because yikes, here comes vaporized tobacco. So this has happened many times through history. So I just like this little study, this little slide to show that, you know, people didn't always smoke cigarettes, right? The cigarette was really invented in the 1880s. Before that, it was much less of a problem. But changing that delivery method to a pre-made smoked cigarette had a humongous impact on the public health. And again, we just saw it again by changing that delivery device. And so all of a sudden, we have had this huge change. So again, we had gotten down to about 5% of high school seniors who had used nicotine via smoking. But now look at this, now it's almost 5% of middle school students and almost 20% of high school students who are vaping nicotine. So that is just a dramatic change. And just to be clear, they did this through science. They did this because they developed something that was a better method of delivering nicotine to the brain. And they did it by changing the formulation, so it was no longer something that was burning, it was vaporized, it doesn't irritate the throat. They changed the solvents that carry it directly into your lungs. And all of that gives you more bang for your buck. It gets that nicotine into the brain faster, which is just what that hungry pleasure reward system of the brain is looking for. So again, I think I'm talking to the choir here, but big marijuana is using the big tobacco playbook. They are doing the same thing all the time, changing the formulations, changing the delivery devices, changing the social norms. And I used this one because I just think it is amazing to think of doctors promoting cigarettes. I mean, how crazy is that even to imagine? But it is no crazier than what is happening right now when we have images of doctors promoting and actual doctors promoting marijuana use. So one of the things that changes, two things really affect use. One is a decrease in the sense of risk, that you don't think it's that bad, you don't think it's that dangerous, and the other is availability. And so I think you guys are really familiar with this, but whoa. So this is as of August 2020, over 500 retail marijuana stores inside the city of Denver. Talk about availability, talk about visibility, and talk about cueing that it's harmless or at least not hurtful. That has a huge impact on the use by our youth. And this is a slide that was put out by my 420 tours. And I think that's amazing because they're obviously a pro-marijuana organization, and they were, I guess they're out of business now, but I'm using it in the anti-thing. The concept of how many more in Denver, for example, more dispensaries, both medical and recreational. This is in 2018. You can see there were 364 dispensaries. And if we looked at Starbucks, there are only 80 Starbucks, or McDonald's, there are only 31 McDonald's. And I feel like, if I want to find a Starbucks in Denver, I'm assuming it would not be hard for me to do. I can tell you where I live in the Washington, D.C. metropolitan area. It is not hard to find a McDonald's or a Starbucks any place that I am. And look how much more it is easy to find dispensaries. And I think that this is just so important to realize the danger of commercialization of a recreational pharmacology like this. And this is why we really need to strengthen this health message. And we need to be really, really clear, and we need to say it to people over and over again. And so it's just normal, like wear your seatbelt, wear your bike helmet, don't use any alcohol, nicotine, marijuana, or other drugs for reasons of health under the age of 21. It's just the way it is. It's the health standard. So some people say, how is this different than just say no? Because we did that already. So I really want to stress that what we're talking about with this health standard is something that is absolutely a health issue. It's not a moral issue. It's not a judgment. It's not my opinion. This has to do with the science of the developing brain, and it has to do with the research that shows that all substance use is connected. So you can't just say, sit back and be like, it's just this, it's just that, it's just a little of this, they're just experimenting. We normalize any use, we're normalizing all use without realizing it, and that's super important to realize. One Choice is also all about supporting existing prevention efforts. So as I said, I love organizations that are have their own specific passion. That's fantastic. I'm thrilled. I can't wait to be, join with you like this. It's wonderful. But we're ready to support you with our data to show how important it is not to forget the other substances and the other devices and delivery methods. One Choice promotes teen self-care on autonomy and provides leadership for teens. And this is so important because these teens often fly under the radar. They don't get a lot of support for not using. It's really the loud ones are the ones that use. So I want you to keep that in mind. And who can make One Choice? I want to be clear about this again. Anyone can make One Choice, okay? Teens that have never used in their lifetime, fantastic. Those are our originating One Choicers, fantastic. But if you've used in the past, you can make One Choice today. If you've had a problem with substance use, a diagnosed substance use disorder, you can make One Choice. It's completely consistent with long-term recovery. I just want to go briefly through the essential role of parents. So I've talked about this a little bit, but I have often an easier time talking to the teens because there are a lot of non-users, and the adults can actually kind of buck against it because they remember how it was in the past. They worry about their kids needing to be cool. They don't want them to be excluded from social activities. So it's really important to know that this generation, they see the problems with drug use. They understand the issues, mental health, and they really want to be a leader in this. So we need to give them that opportunity. So what can adults do? Talk early and often about the expectations of no use, fit One Choice into your families, your communities, vision for health and wellness. And as adults, check your own substance use in terms of modeling appropriate behaviors and considering family risk factors. And again, I really want to make sure people shine a light on themselves as well. Just to let you know, there are a lot of organizations who have joined us in this, and it's been very exciting to work with these kids. There's a wonderful organization in Rye, New York called RYACT, and they put together this amazing campaign called I Am One and I Make One Choice. And these were mosaic tiles that the different kids wrote things on it. They have more than 800 tiles of kids writing what their personal reasons for making one choice are. And they're so proud to be able to share that. They also have some great videos on that if you ever want to look at that. So please remember the unique impact of marijuana, alcohol, nicotine, and other substances on that adolescent brain. Remember that all drug use is related. It's all connected. And let's all work together to support our youth to make one choice for health. So my last little bit here is thank you so much. Please consider joining our One Choice community and getting in touch with us, going on our website. We would love to share your information and have you share our information.
Wonderful. Caroline, thank you so much. I personally love graphs and charts and think they are so very interesting. So resonated very much with your presentation. We do have a few questions. And so I'm glad we have plenty of time left. So please type those into the question box and we will go in order. John Byram has a comment for everybody to know that North Coastal Prevention Coalition, woo, shout out to North San Diego County, has adopted the One Choice message. So he just wanted to give you a shout out there. Let's see, we have a comment here. Deborah Hasten's JAMA Psychiatry article in 2015 found a prevalence of cannabis use disorder in the 30% range for users of marijuana. He's curious how that squares with the chart of age of first use on slide 7. He wondered about that, and I don't have the slide up here on the screen in front of me, and we don't need to go to it, but are you familiar with Hasten's JAMA Psych article?
I don't know specifically about that article, but I do think you're right that you're going to see slightly different data depending on what data set is used and who you're asking and how the question is specifically asked. And so what you're saying is that it's 30%. Say the question, say it again.
Well, some of this research, as you said, varies greatly.
Yes.
Hasten's JAMA article basically said a 1 in 3 roughly,
yes.
1 in 3 youth who start using will develop cannabis use disorder. So
yeah, I have to say that I've seen higher numbers as well.
I'm wondering if that's related to the age of the study. And I think the one you're showing was from 2004. But now that the concentrates have come out and, of course, are far more potent than they used to be, I believe 1 in 3 who use, especially today's potency, even in flower, in Colorado, there's a grower that has flower upwards of 40% THC.
I was thinking about that. It's going to really depend on what your population is. So again, most of my data is national study doing long-term longitudinal studies. And sometimes it has to do even with that, how they're asking the question, like, are they just talking about smoked marijuana, for example? That would be a great point. So I am going to accept what you're saying from the JAMA article, that it is, that the risk is very high. And so
yeah.
Love it.
Okay. And they're totally different studies looking at different things. And yes, the age does. Okay, related to that, one of the studies you mentioned showed the use of the word cigarette, and you commented on that. Caroline, she was asking what year was that study conducted? She missed that.
Oh,
do you know?
So yes, so that's the studies that are showing like the past 40 years. And so they continue to do that study annually.
Okay, so they still use cigarettes, even though
cigarettes. And so I'm going to be really interested to know if they're able to change or add a nicotine question to it. because if you ask about cigarettes, you're missing the point
You're
right
missing
now.
that. So that
So
the latest data
unfortunately,
from that, I think, was 2018. I think I
yes,
saw on the
exactly,
slide. Yeah, the
exactly,
Healthy Kids Colorado survey had to do that in 2015 since marijuana was legalized recreationally in 2012, and in
right.
2014 it really started coming out and hitting high schools. But they added a category for dabbing in
Mm,
2015 into their chart, so you see it just kind of boop, abruptly show up.
yes.
So hopefully some of that longitudinal
Oh,
data will.
I think it's 100% going to show it, and I'm very concerned. One of the things, going back to that slide, if you can kind of picture like alcohol's coming down and
Yeah.
tobacco was going down and marijuana was kind of like bopping along at a kind of equal. I think it's not going to stay equal like that. I think all of us are very concerned that that's going to go up. And what you're going to see is that it's going to eventually pass alcohol as the most commonly used for adolescents.
Well, and in some states, that is already the case.
Yes.
In many of the legalized ones, which, as you know, is why we really focus on marijuana, even though we completely agree with the one
Yep.
choice message and know that all substances, of course, impact adolescent behavior and are related. And we are totally on board and agree with that. And we see cigarette use hugely plummeting, alcohol use plummeting, and interesting because even though alcohol was made illegal, well, so is marijuana, but it's not keeping kids from getting a hold of it and using it, even in states where it's legalized recreationally till the age of 21. And those who are 18, they can get med cards.
Yes, exactly. But you know what's interesting to me is a lot of times when I talk to kids and I say it's not legal until 21, they don't know that. They're totally confused by that. They hear it's legal and they don't even understand that it has an age that has the same age restrictions. So I think that getting that information out there is vital.
Yes, we are working on that. And a lot of it has to do with media, with marketing directly to our youth, with big pot, with parents themselves using, with messages that it's not harmless, confusion on the difference between medical, if you can get a doctor to give you a med card, because of course you have chronic pain at 18, then, that's confusing. Well, wait, is it 21, right? So there's just so many different states, different rules, different regulations. And this is our big concern, as you're talking about, that will continue to go up, especially as marijuana becomes
and one of the things that's so
federally
important, sorry, that you said also I think is really important is like, yeah, we've seen cigarette smoking go way down, but those vapors actually start smoking cigarettes. And so we see that they're flipping over, and I thought, no way would this smart generation start smoking cigarettes, but they are, because
they
again,
know. And they know it's bad.
It's bad.
That's addiction. Is there a suspected cause for the blip in drug use in the early 80s?
Yes, I love that blip, and I don't have actually a great answer for it, but I have a lot of speculation. I think that it was what was happening in the world. And if you look at the movies during that era, at the television shows during that era, at the music during that era, it was very pro drug use. And there was just a lot of drug use exposure. So I think that really did reflect what happened during that. I mean, obviously it's true data, but I mean, I think it kind of makes sense that there was a real loosening up of exposure, of like showing people all sorts of kind of glamorization of drug use during that era. And it just blossomed into those incredibly high numbers in that early 80s time.
Okay. Can you talk a little about the increase we've seen in teen anxiety and depression, and how the mental health concerns we have can be linked to the risk of substance use disorders?
Oh my gosh, yes, I love that topic. Oh my gosh, because
that's probably a separate seminar.
Yes, exactly. So absolutely 100%. I think they are linked. Let me just say this. There is no condition that cannot be made worse with drug use. So it may be that for some people, the drug use causes the anxiety and depression, and we absolutely see that in some people. And for other people, it makes what existing anxiety and depression exponentially worse. And it's
And that's
very
funny because they tell us that, oh, it's you can chill out.
Yes, you can. And it's interesting. I have talked to people, so many people who have said, oh, I never thought I needed to see a psychiatrist, but my anxiety is out of control. I've had anxiety my whole life, but now it's out of control. And I asked them, what's their marijuana use like? And they're like, oh yeah, I use it all the time. It definitely helps me. And I'm like, oh, it helps you. Good.
Right.
Tell me about that. And you can see that they were anxious. Some smart person told them, oh, you should use marijuana, it will help. And they started using it. And then they used more and more, and their anxiety is getting worse and worse. But they get an immediate response when they use it that seems to calm them. And so they associate it with feeling calmer. But then they get this horrendous rebound anxiety that is just walloping them. And they don't realize that that's from the marijuana. And it's a very hard sell, but when I can convince those patients, and they really come in all ages, but a lot of them are like high school and college students, if I can convince them to stop the marijuana, I haven't had a single person who hasn't come back to me later and said, oh my gosh, you were right. You were right. That, oh my God, it feels so much better.
Yeah. So a
But
short-term
really
fix.
hard sell. It's a hard
sell. And in your work as an MD, which substance do you think impacts adolescent brain development most, i.e. causing psychosis or schizophrenia?
So here's the deal. I definitely think marijuana is a huge culprit of this. So I'm right with you guys that I think marijuana does this. Absolutely. I've seen it have devastating effects.
Yes.
But the reality is all substance use is connected, and very few people are single substance users. People use drugs combined. They are polysubstance users. So it's really wrong on the prevention side to just only ever talk about one drug. It is also on the treatment side where I get someone who's like, oh, I'm in recovery from alcoholism or recovering from opiate use disorder. Great, fabulous. But if they're really in recovery, they have to stop everything, right? You don't just stop one thing. So I don't know for sure that it's just marijuana that's doing that. I think the other drugs are doing it too. And I think the combination probably makes it significantly worse. And so what I would say is it's very scary because you realize, you know, our brains are susceptible to all sorts of things, and you might have a genetic susceptibility. People ask me that a lot of times, but it's very concerning to me that someone would say, oh, I don't have a genetic susceptibility, so therefore I'm fine. And I always say, look, if you have a brain, you are at risk for a substance use disorder, and you're at risk for a really bad outcome like psychosis. And that's all you need is a brain and use. And that's what you need to be at risk.
Okay, we've got just a couple more minutes and like 4 questions. So let's see if we can get through them quickly. What kind of impact on overall substance use do you project the pandemic will affect?
Oh,
like
so bad.
30-second answer.
A lot. It's going to have a lot. The kids are lonely. They are disconnected. They are sad. And the substances are available, and they're available all around them, and that is catastrophic. So and also a lot of the things that keep people from using, like being engaged in sports, for example, you know, those things don't exist. So bad.
Okay. Is there a way to overcome the medicinal branding of marijuana use? E.g., how do we ensure that one choice method addresses medicinal use as well?
So use is use. And you have to understand you're talking to a doctor. I'm interested in FDA approved medicines. And I honestly can't understand what the FDA is doing about this topic. I just don't get it. I have never seen something that is approved by the FDA that is a plant or a candy or all of these other products.
Dab.
Yeah. I mean, what in the world is going on? This is not medicine. So I think we need to be really clear from a medical point of view that this is not medicine. And we need to also remember that all medicines have risks. And if you pull out your Tylenol and look at the risks of taking Tylenol, it has a list like, 3 pages long of dangers of Tylenol use. And so the idea that medical marijuana is not risky is ludicrous. Everything like this has a risk. And so we need to really put that risk front and center and make sure that our risk benefit ratio makes sense. And I can pretty much guarantee you it will not make sense.
And to make sure they're followed up, they're tracked, like you can't go and get multiple opioid prescriptions filled in a day, but you can go from dispensary to dispensary to dispensary and get them filled. So it needs to have some of those same standards. It seems like there are a lot of loopholes we need to tie up. Everybody is saying thank you, thank you, thank you, thank you. I'm getting a lot of thank yous. And with that, we are out of time. So Caroline, we want to thank you so much for your gift of your time and your wisdom. And we are so grateful that you are one of Johnny's ambassadors.
Thank you so much. Thank you for letting me come. I'm thrilled to be here with you guys. And I'll look forward to seeing all of you in the future over at our One Choice community.
Yes, we will join you there. Thanks for attending, everyone. See you soon.